This is the talk show that takes a no-holds-barred approach to politics, where truth and integrity are the standard and the Constitution honored. From Renaissance Studios, this is Champion News Talk Radio.
Good morning and welcome to another great edition of Champion News Talk Radio, brought to you by championnews.net, your choice for the conservative voice. This is Carol Parisi. Today our founder Jack Roeser and myself have a great guest with us, Stephen Tucker, and we are going to talk about the past week, Monday, Tuesday, and Wednesday, the Supreme Court and Obamacare.
Yes.
Obamacare. Good morning, Jack. How are you today?
Oh, I'm just fine, and it's really appropriate that we've got Steve on board here today because the news is caught up with your whole career, because you stand in between the patients and the crazy government and all of the money, and you're very familiar with all these multitudinous ways of somehow making care available to people that are sick. You know, I'm an old guy. I'm 88 years old, and I go way back very consciously to the time when there was no health insurance anywhere, and that was before World War II. And the health insurance thing started with the companies back then because the federales had limited the amount of pay that they could give to people, and some companies liked their employees a lot and wanted to pay them more, so they gave them big vacations and health care.
That's right.
And it became institutionalized, and more and more it got to be tighter and tighter ways of controlling what was happening, until along came Mr. Obama, and with Obamacare, spelled with a K. And,
I love that.
But Obama's decided that he was going to be our daddy. I won't go into it too long, but I damn near died back in 1933 when there was no insurance, no system for taking care of people other than doctors and hospitals did what they did. And I spent 6 weeks in a hospital, 2 weeks in a coma, but my dad was a salesman, and one way or another, I obviously survived the no government care of the 1930s. Never knew that it was that big a burden. My dad died in 1958, and I'm proud to say that I paid his last hospital bill. Didn't really have to, because my dad wasn't broke, but I'm proud that, and you know, the risk of this whole thing of our health, and every other problem that's around you is properly first solved at the family level, where you conduct yourself with your own family, your own parents, your wife, your children. You got a responsibility for each other, and you keep your nose clean. You don't do stupid things that get you in money troubles, drug troubles, women troubles, guy troubles. You keep your snoot clean so that your family is still going to respect you and take care of you. So there's a moral part to handling a lot of our problems at the level where we handle them as Americans in a free country, using our ability to buy the car, the house, the food, the vacation, and the health care that we want. It's hard to find the government making better choices than we would make with our surrounding group of people we work with. It's too bad that Obama thinks it has to be all him. I've written a long list, which we'll get into maybe later, but Steve has been at the practical interface of how the hell to get money into some of the rather unworkable government systems we presently have that inhibit private initiative. Right. Steve?
Well, yeah. Steve, you have a website, right? It's called The Truth About Obamacare.
Truth About Obamacare, not the.
Truth About Obamacare.
The is Sally Pipes, Pacific Research Institute. She has The Truth About Obamacare. That's a great book, by the way.
Okay. Now, also,
What's the name of the book?
The Truth About Obamacare by Sally Pipes. She's the president of Pacific Research Institute.
Is that available on the internet?
Available? Yeah, it's about $7 in softback. Every American should read it.
you probably can go to your local library on your taxpayer dollars and take it out for free.
Correct.
And the name again is?
The Truth About Obamacare.
And you take the away, and that's your website.
That's my website,
And
Truth About Obamacare.
Steve has been championing healthcare forums for the past 3-4 years.
Correct.
You have been going around the whole state, even around the country, right, Steve, speaking to Obamacare.
Yep.
And what the Supreme Court decides on this, I think, is going to have a huge impact on the reelectability of this president if they find it unconstitutional.
Yeah.
But let's hear a little bit about Obamacare, anything new with the mandates, and what the Supreme Court had discussed this past week.
It was probably the most enjoyable Supreme Court session I've ever heard in all the years, because I've never heard open laughter in a Supreme Court hearing. I've never heard the judges shush the audience because of open laughter. And it is because the president's ambulance chasers, which is what I call his attorneys, are trying to twist the Constitution to fit their needs. And they cannot possibly do it. They can't do it under the Commerce Clause. They can't do it under the I call it the Good and Plenty Clause. That's what one congressman called it. There is no constitutional precedent. There's no historical precedent for Obamacare and the law, the section called the individual mandate, to compel a citizen just because they are alive to enter into a private contract with another entity. There is no precedent for that. And anyone who knows a contract knows that both parties have to be in agreement on that contract. If that contract is signed under duress, then that contract is rendered null and void. So even if we didn't compare this,
must be a meeting of the minds.
That's correct. And you must agree on that contract, and then you sign that contract, and then it becomes a binding. But any contract can be null and voided if it was signed under duress. When you shove a piece of healthcare legislation down America's throat on Christmas Eve, December 24, 2009, without one Republican vote, that is under duress.
But
And incidentally, it wouldn't have gone through
if
if they hadn't unjustly convicted Senator Stevens, and they railroaded that guy out of the Senate. And if he had not been railroaded by the Democrats, that thing never would have passed. That's how skin thin the margin was.
Now, wasn't it March 23rd, 2010
when
that
it was
it
signed.
actually was signed?
Correct. When it passed through the Senate in the middle of the night on Christmas Eve,
Christmas Eve.
which was
Remember all
December
the snow?
24th.
Do you remember all the snow in D.C.?
Yes, yes. I actually wish it would snow more in D.C. so that they couldn't get anything done. But so when that happened, ever since then, even in the conservative movement, even in the Tea Party movement, a lot of people think and believe the left's narrative that Obamacare doesn't even begin until 2014. And that is a huge misconception. There has been so many segments of this legislation that has already been implemented to the demise of the health insurance industry, to the individual policy holder, to the state taxpayer, to the federal taxpayer. All of these things have been implemented. One of them, and probably the most onerous, is the medical loss ratios. I referred to this yesterday when I did an interview on Fox News. No one's discussing it either. The medical loss ratios implemented and began on 9/23/2010, 6 months after the legislation was signed. And what that states is that if you are a health insurance company and you underwrite less than 50 people, you must have a total operating margin, I'm not referring to profit margin, total operating margin of less than 20%. If you underwrite more than 50, you must restrict your operating margin to 15% or less. So companies like United Healthcare, Humana, the bigger companies, historically, they would run on a 75-25, 70-30. This would give them the ability to pay their employees, provide benefits for their employees, marketing costs, returns to shareholders. All of these things were now dramatically hindered because as of January 1st, 2011, you must now comply with the new medical loss ratio. So the first thing that happened was...
And that ratio is compelled to be?
85-15 if you are a company that underwrites more than 50, and 80-20 if you are a company that underwrites less than 50.
So it's a razor-thin margin.
That's correct.
That they're supposed to operate
And the first thing that happened was they cut all commissions for health insurance brokers in this entire country in half, which led to many people like me out of the industry.
Half, they cut your commissions to half?
In half on 9/23/2010. Every carrier, not just one carrier, any carrier you sell, your commission has now been cut in half if you underwrite and place individual health insurance policies. Second, the health insurance companies looked at their operating margins and said, we can't do it. So we have now lost 20 health insurance companies since this legislation went in place, leaving people with either no health insurance or health insurance that is dramatically worse
So
than what they had.
Obamacare is already operating.
Yes, sir.
Not doing any good, just harming the system.
Well, I know personally our family's paying more for the health insurance.
Oh.
It's all over the board.
Oh.
And we weren't supposed to pay more.
We were promised we wouldn't.
You know what? We are going to hear about C. Stephen Tucker, Truth About Obamacare, when we come back after the break.